If you have Medicaid or state health insurance, as Medicaid is called other things in various states in our country, this video is for you. The House Energy and Commerce Committee has advanced the piece of legislation with all of the Medicaid/state health insurance cuts, as well as health provisions. It's 160 pages long, and it took them about 26 hours to debate, and the final vote was 30 to 24. Let's go through the cuts. I'm going to go through all the cuts that affect you, and there are some cuts that are cuts to states that don't directly affect us. I'm going to go through the most important ones. If there's questions that you have, put them in the comments, and I will, of course, get to those. And it's also important to know that just like with the food stamps, there are cuts, individual cuts, right? And each cut is going to be effective at a different time. So some cuts will be immediate. Some cuts, most cuts, don't even occur until January of 2029. However, anything to do with what Medicaid covers, that's going to be immediate once this entire big, beautiful budget bill is passed. Let's go through the cuts now. First up, Medicaid will not pay for any services at Planned Parenthood or any nonprofit organization or any community provider who also offers the service of abortion. So it doesn't matter if you go into a nonprofit organization, community provider, or Planned Parenthood and want an STD test, or you just want a PAP, or you want birth control. It doesn't matter if you're a man or a woman. Medicaid will not cover any of those services if that place offers abortions. And this is going to be in effect immediately. So once this entire big, beautiful bill is signed by Trump, that will be in effect. Medicaid, also state and health insurance, of course, will not cover puberty blockers, hormone treatments, or any surgeries for persons under 18 years old, gender-affirming care. States will be prohibited to allow coverage for any gender-affirming care, any part of it. So if you currently are on Medicaid and you receive testosterone or you receive any services that have to do with gender-affirming care, you will no longer be able to get that through Medicaid. You will have to pay out of pocket or purchase your own private health insurance and see if they cover it. And there is no more coverage for gender transition procedures for adults. That's it. This will all be immediate once it's signed by Trump. Now, just as we saw with food stamps, with Medicaid, if you're an able-bodied adult aged 19 to 64 years old, you must work at least 80 hours per month. That's 20 hours per week. It's a requirement if you want to be on Medicaid. And then, of course, you have to meet all the other requirements. And this goes into effect in January 1st, 2029. Currently, those on Medicaid recertify once a year. You will now have to recertify every 6 months, and the amount of paperwork will be an incredible amount. It'll be a lot more than what you're used to, and it will include you providing a lot more proof of your bills and who you are than what you normally provide. You must provide proof that you are a U.S. citizen. Plain and simple. No steps beyond that. If you're not a U.S. citizen and you don't provide proof, you don't get Medicaid or state health insurance anymore. And any state that allows even one person on Medicaid or state health insurance who doesn't provide U.S. citizenship proof, that state lose all federal funding. So I don't see any state allowing it. They are also reducing the number of nurses that will be allowed in nursing homes. And lastly, every person on Medicaid will have to pay a copay when you see any provider. You will now pay $35 every single time you go and see any provider. It doesn't matter if you're elderly, disabled, children. It doesn't matter who you are. If you're on Medicaid, it's $35 to go see a doctor. It's estimated that 13 to 14 million people are going to lose health care as a result of these cuts and the more strict paperwork requirements, as well as these copays are going to really hurt people. $35 might not seem like a lot, but to some people, $35 for every single doctor's visit is a lot of money. So now this piece of legislation gets sent to the House Budget Committee, and the House Budget Committee takes this piece of legislation and all the other pieces of the legislation of like the 1,000 pages, and they combine it together to make one reconciliation bill. The Senate does the same thing. And so then the Senate and the House Budget Committees take their one bill, reconciliation bill, and they combine them together. And that is the one big, beautiful bill that then gets voted on by the House and the Senate for approval. And then when approved, it goes to Trump for signing. So we have some more steps, of course. We'll see what occurs, but those are the cuts for Medicaid. Those are most of them. And I will keep you updated for sure. Please like, follow, and share so that I can continue to provide you with content. And I appreciate you being here.